Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker.
Sierra Owens.
The always thoughtful, the transformational, the tremendously talented Sierra Owens. Let's get that right.
Let me tell you, Mr. Will Rucker, the wonderful, the magnificent, the oh so charismatic. Like, hype me up and I will do the same.
Well, we have a dynamic show lined up today. We've got one part heart, one part health today.
Yes, and I love both of them. I hope everyone listening takes something from both because it is very important that what we're talking about.
Absolutely. So how are you today?
Well, trying to keep cool in this weather, stay hydrated, keep my voice going, and just really make time for the sun. What about you?
I'm doing well. It's been a hot minute since I've been on the air.
Yes.
So I'm excited to be back, and I'm going to throw something new at you.
Oh.
So pick a card, any card. This is Vegas after all.
I love a card of any kind.
All right, read that for the people.
Oh, this is an affirmation card to brighten our day. So I am able to find lessons in my defeats.
Oh,
that's powerful and something that I definitely am leaning into right now. I'm in a season of testing and moments. So, and every single thing has a lesson and a blessing. So I definitely receive this.
That's right. Well, that's your card for the day.
I love this. Thank you, Will.
Absolutely. Well, we have two incredible guests with us, and I don't want to delay because we've got a lot to talk about. But as always, I want to remind you that the Healthier Tomorrow Radio Program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Southern Nevada Health District is dedicated to ensuring that infants, children, and adults are immunized against vaccine-preventable diseases. To book an immunization appointment or learn more, visit our website at www.southernnevadahealthdistrict.org or call 702-759-0850. So with that, I'd like to welcome our first guest from the Southern Nevada Health District. She is new to the program, but we've had a chance to talk a lot off air, and she is an absolute delight. So good morning, Jazzmin.
Good morning.
How you doing?
I'm good.
Good. She even got quiet now that we're on the air.
Yes.
I'm so excited to have you here and talking about the program called Embracing Fatherhood. But before we get there, I want to learn just a little bit more about you. So tell us about yourself, your role with the health district.
Yeah, of course. I've been at the health district for almost 5 years. I started off as a community health worker providing services to moms with children under the age of 1. And then about a year and a half ago, I became a program coordinator, which I now lead 2 teams, our Embracing Fatherhood being one, which is our fatherhood program. And I've been ever since 2020.
Congratulations. That's awesome. So career advancement.
Yes, that part. She said I lead 2 teams, y'all. 2 strong programs.
So if you're listening, this sounds like something of interest, or you know somebody that's a parent, a caregiver, a grandparent, an educator, or a human being, let them know A Healthier Tomorrow is on the air and they should be listening.
So, Miss Jazzmin, what is Embracing Fatherhood? That's one of the 2 programs that you lead. Tell us about it.
Yes, so Embracing Fatherhood is a new fatherhood program at the Southern Nevada Health District. It's a free and voluntary home visiting program specifically tailored for dads living in the greater Las Vegas or anyone just stepping into the father role. The goal of the program is to empower fathers in their new role, as well as strengthen families and improve child health outcomes through the education we provide and the resources that we link our clients to.
Amazing. So who all is eligible?
So anyone who is living in the greater Las Vegas area, so either can be a new father with multiple children, or anyone stepping into that father role. So it can be uncles, stepdads, brothers, just anyone who is willing to learn, educate themselves, and want to have more education on what it is to be a father.
I love this. We're expanding that role of what it means to be a father. Oftentimes we do it with a mother, so father is very key.
Yeah.
What does it look like to provide the support, specifically like a home visit? So like I know what a home visit means like from the education standpoint, but what does that look like when you're supporting these new dads?
So it's more of a conversational type of appointment. We go into their home, make them feel comfortable. We're not there to judge. We're there to just support them, provide them with education, any questions that they may have as far as, if if the baby's eating well, or doctor's appointments, or anything that we can just expand the information more in depth for them. That's what the home visiting services are more for, as well as link them to any resources. We do provide services at least twice a month, or as frequent as the dad would like. So we do have dads that want us in there at least once a week, which is awesome. We love it. And we just, every home visit is different. So sometimes it can go as far as 1 hour, an hour and a half, 45 minutes, all depends on what the client needs at that visit.
I love that differentiation, that personalized, individualized support.
Yeah, because we all need different things.
Oh, definitely. Yeah. And every day is different, so we never know what we go into until we get to that appointment.
Oh, adaptable, just flexible.
Yeah. So besides the dad or the father figure, who else can be involved during the visit? The other family members?
Yes, so we do encourage other family members to be part of the visit. Though the program is just tailored to the dad and the child enrolled in the program, anybody else in the home. So if the dad does have children older and they want services for them, we also provide services as far as like any resources it may need. So say, for example, there's a child who's getting ready to go into school, so like kindergarten or pre-K, and they're looking for resources of that sort. We do provide that for that specific child. Or if there's a mom who is in the home, or any other family members, anything that they may need, we also bring that some resources with us to that visit. So we involve the entire family.
It takes a village, and the village is all educated. That's really dope, Jazzmin,
yes,
hands down. So you've mentioned resources. Tell us about what resources are being offered and who are you partnering with in order to provide it? Because once again, it also takes a village to support the village.
Yeah, so the resources can go far as rental assistance, baby items, diaper banks, food banks. One of our biggest one is mental health, so providing our dads to linkage to services of that sort. Okay. We do have a great partnership with Dads Inc., which is also program for dads, and they have a lot of different workshops, so that's something that we do linkage our clients to provide them with that extra support. So the list of resources all depends on what the dad is looking for, and if we may not know it at that home visit, we do come back to the office, search it up, and then bring it on to the next one.
Sierra, did you hear what Jazzmin just said?
Which part? All the dopeness?
All the dopeness.
Jazzmin, y'all are delivering and fostering, and especially like when it comes down to a child. Sadly, oftentimes everyone's like, is the mom ready? Is the mom okay? And all that good stuff. No, is the daddy ready too? Like, is he equipped? Is he okay? I don't know, everyone's been going around. Nelly has 1 million kids, but now with Nelly's new baby, with Ashanti's like, I ain't changing no diapers. Right. So how do we support and how do we keep going? So I love that. So how do we get involved?
So you can definitely, our health district has our website. You can, for those who are interested in enrolling to the program, they can go on there, do their interest form, and within a day or two, we do call them back, give them a little bit more information about the service that we provide. And if it's something that they're interested in, we can start as soon as they're ready.
I love that this is happening. So for our listening audience, they've heard us talk about these programs for moms, and I always ask, well, what about the dad?
Yes.
So I'm just over the moon elated that you are here with this program and that it is so robust. I love that you got the mental health piece. You started with rental assistance. We kind of went by that pretty fast, but if you don't have a place to stay, that's kind of hard,
exactly.
Yes.
So that's really foundational for health in general. So I just want to say thank you for this amazing work and these resources.
Of course, thank you.
So now, how long is this program? How long does it last?
So it all depends on what the client needs. Our goal is to service him as long as possible. The program does go until the baby turns 4. So the latest we can enroll the client is at 3 years and 6 months. But if they want to continue as early as pregnancy until the baby turns 4, we can also do that.
So if they missed that first window, up to 3 years and 6 months, they can still take advantage of these resources.
Yes.
Thank you.
Yes.
That's fantastic.
Yeah.
Absolutely.
All right. Thank you so much, Ms. Jazzmin. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Our Barbershop Health Outreach Project is hosting the annual Shop Talk event on Thursday, August 7th at Blade Masters from 5 to 8 p.m. This year's theme is Real Conversations. When we talk, we heal, and when we heal, we thrive, and focuses on connections within the next generation of young men and the relationships between fathers and sons or other mentors. There will be free back-to-school supplies and food while supplies last. Registration is required for free haircuts, y'all. So to learn more about the event and to register, visit www.gethealthyclarkcounty.org/shoptalk or call us at 702-759-1270.
Awesome. Now, we know that embracing fatherhood extends beyond just in the home with the changing of the diapers. Kids also need some things before they head back to school to class. So we've got Dr. JP, who is the Vice President of the Nevada chapter of the American Academy of Pediatrics here, bringing us the facts on back-to-school vaccinations, why they matter, what's required, and how families can catch up if they've fallen behind. So, Dr. JP, welcome to A Healthier Tomorrow.
Thanks so much. Happy to be here.
We are so happy to have you. Now, Dr. JP, I am an educator like through and through, so I love this conversation. It's something that I think is very intriguing. Why are we talking about it now? Why are vaccines important?
Well, I mean, I think, going back to school and everything, kids are getting in close proximity. You've got people, teachers and parents and everybody all together, and that really kind of helps to spread disease, and so I think that getting vaccinated, making sure you're protecting kids against that is really important. And it's not just about protecting your own child, but also protecting other people as well, the ones who can't get vaccines, the babies who can't get it, elderly people who can't get it, people who might have immune compromise, their immune system is not what it's supposed to be. So it's really helpful for everybody. And of course, I mean, we've heard on the news a lot probably about things going on in the vaccine world, some skepticism going on, maybe even some politics involved in that. And so I think it's important at this point in time to talk about this and make sure that people are aware vaccines are safe, they're effective, they're one of the most effective ways to prevent disease.
Yes, you talk about it being foundational, and even we're gonna sit there. We talked about off the air that it's not even just on the news; it's starting to penetrate pop culture. SVU is having episodes on vaccines and different things of that nature to raise that awareness and really have to get the conversation started. What is something that we can do in order to ensure and understand how safe that this truly could be?
Well, I think, just kind of asking around, and making sure that you're validating the sources that you're looking at, making sure you're looking at people who you can trust. And I think one of the people who hopefully you can trust is a pediatrician, because going to a pediatrician can help you not only, look at vaccines, but it can also help you to make sure your child is growing well, developing well. It really is a good trusted source for anything having to do with your child, and also can help you evaluate some of the sources that you may be looking at, because as we all know, I mean, not everything you look at out there is something that's legit, and so it's not something that you can necessarily trust without kind of knowing from someone who knows.
Now, you are, in fact, a pediatrician, and I wish we were, like, on TV so people could see you, because you look like a pediatrician.
If we have a look, then I guess I'll take that, yeah.
No, but it really does, because it is that importance of being able to trust someone and to have messengers that resemble our communities and that look like the people that we already know, love, and trust. So, that's so important. Now, Nevada schools actually have some pretty specific requirements for vaccines. Could you share a little bit about that?
Sure, absolutely. I mean, I think there's some recommendations, not just recommendations, but requirements, that you can go to school, but you can't really go to school without having certain vaccines. For example, going into kindergarten, you have to have the DTaP vaccine, which is protecting you against diphtheria, tetanus, and pertussis, polio, MMR, which is measles, mumps and rubella, and then varicella, which is chickenpox. So you have to have the boosters of those vaccines to get back into school for kindergarten. And then for 7th grade, when you're going into 7th grade, you have to have a meningitis vaccine booster, and you have to have a booster of the Tdap, which is, again, the tetanus, diphtheria, and pertussis. So I think those are the ones that are pretty important to get you back into school, and that's what hopefully you'll be getting over the summer.
So talk to us, Dr. JP. There's always people that say there's some exemptions. So what does that look like? Because we heard required for Nevada school.
Right. Yeah, I think there are some exemptions, of course. I mean, there are medical exemptions, and then there's religious exemptions. And I think that that's been a topic of some challenges and some controversy, because you can what if you find somebody who's just willing to sign off on that, and not necessarily looking at all the evidence? And so I think in Nevada, we have to remember that the only exemptions are really medical exemptions. In other words, you might have had a reaction or a allergy or something to a vaccine or a vaccine component, which means you can't get that vaccine again. That's legit. I mean, you can't get it. And then religious exemptions, there are just some religions that, don't necessarily allow for that. And so that's legit. But, other kinds of exemptions can be a challenge. And I think that that's the ones that we kind of have to look at carefully.
So if you're saying, if it's a personal belief of mine, or philosophically, I'm saying I don't agree with vaccinations, that's not an exemption that I can easily do.
You got it.
Well, that's good to hear, because vaccines don't just protect the individual. It's really a community thing. So immunocompromised classmates, babies, too young to get vaccinated, and even the elderly. I think about my grandparents. They need to be protected too. So this is really a community responsibility when we look at vaccination. So, we're not too far off from COVID. And a lot of families delayed routine care because of the pandemic. So if they are behind, is there a way for kids to get caught up on their immunizations?
Absolutely. I mean, I think there's a lot of different ways to do that. One way that I'm going to advocate for, just because I'm a pediatrician, is go to see your pediatrician. Having that contact point again, getting back in with somebody familiar, somebody who knows your child, somebody who knows how to tell you whether your child is growing and developing properly, and then also getting vaccines and also getting caught up. There's a lot of other areas that you can go to get vaccines. One is, of course, the Southern Nevada Health District. You can go there. You get vaccines from there. You can go to a lot of the retail pharmacies now have vaccines. You can go there. And then certain, things will pop up in the community here and there, like they'll go to have a vaccine fair at the mall, or they have a vaccine fair other places. You can do that. But I really suggest that if you can, go into a pediatrician, go into somebody who you can trust and talk to and do all that.
Absolutely. Go to because I'm thinking so many thoughts at once here. But when you go to a pediatrician, there's more than just the actual vaccination that's happening. There are so many other pieces that you check for from a development standpoint. And now a lot are looking at mental health too. So I think that's so important.
Absolutely. I mean, I think that's one of the biggest topics now. And, it's getting to be that, when I was in high school, I mean, I never really quite thought about all of that stuff. And now when everybody's in high school and even starting in middle school, they're starting to have some mental health issues. And so getting them in, evaluating for that, making sure that we're not missing anything, because kids are important, kids are valuable, and I want to do, parents want to do, everyone wants to do what's right for the kids.
For sure. Can I throw something a little controversial at you? Are you ready for it?
All right.
Measles.
Oh, let's talk about it.
Yeah, measles. It's making a comeback, unfortunately.
How is it making? Didn't we get rid of this? Like, I'm so confused. Help! I'm sorry.
No, you're right. I mean, I think that we did eradicate it. It was declared eradicated. Now it's coming back just because there's been a lot of stuff in the news, and there was a study, unfortunately, that came out that linked MMR vaccine, which is measles, mumps, and rubella vaccine, with autism. So that is the controversy. There's been many studies after that discredited that and said that there really is not a link between MMR vaccine or any vaccine and autism. But unfortunately, as you know, when things get out into the media,
it's hard to take
it back. And we did see people start to not take up MMR vaccine, and as a result, you're starting to see it come back in a lot of states. I think when I was looking yesterday, over 30 states have reported cases of measles now. Nevada, we haven't had one reported yet, but I'll tell you, it's probably here. It's here. You just haven't had it reported yet. And so I think in order to, protect everyone from that, everyone who can get vaccinated should get vaccinated so that we can prevent that from becoming a problem.
So let's talk about just the infrastructure right now of vaccines, with of the erosion of the infrastructure, I should say, within our government. Can you talk about that? We know we have a lot of changes, a lot of movement.
Yeah, there's been a lot of changes. I mean, as in the past couple of weeks, you saw the CDC's Advisory Council Committee, or rather, on Immunization Practices, or ACIP, which is kind of the main body that advises on vaccines. They're made up usually of scientists, and medical professionals and other health professionals, public health officials, disbanded, fired. They got them taken out. And not only that, but they were replaced by people who have said that, they are vaccine skeptics. And there's some, on there who are vaccine skeptics. There's some on there who don't really believe in vaccines. And so that's a really kind of a challenge for us as pediatricians, but also, public health and in the community, where we're already starting to see vaccine skepticism, and then to have that kind of in the community, in the news, from the government, makes it really kind of difficult for us.
So we know that we should not be listening to social media personalities. We need to be listening to the people that are on the front lines, on the ground, such as you, Dr. JP. But for those that may be skeptical, what are things that they can do outside of seeing the pediatrician, or while they're there, to kind of ease their minds?
Yeah. I mean, I would say, we're not trying to just force this down anybody's throat. We want people to do their research. We want them to look at things. We want them to talk to people, but we want them to go to the right sources. We want to go to the sources where things are validated. You have a lot of science behind it. You've got people who've looked at this over and over. And so I think there are a couple of sources that you can go to. And if I could mention them, I'll mention that the American Academy of Pediatrics has a website called healthychildren.org. That's healthychildren.org, and that's a place that you can go that's got some great validated resources. Also in Nevada, there's something called Immunize Nevada. So I think that's some place you can go to. Just learn about it, because at the end of the day, as a pediatrician, as a parent, as a caregiver, we all want the same thing. We want our children to be healthy, and as much as we can kind of have that conversation, I think that's the most important. Let's keep talking about it.
Yeah, it's so important to have the compassionate aspect as well. And I jest and make jokes about this because, the science has kind of been settled for a long time.
Yes, this is not experimental.
But that being said, the most important thing in a parent's life is usually their child. And so if they're doing something that they think could be potentially harmful or have side effects or things, I think that is totally reasonable to be skeptical and to have questions. And that also makes it so much more important to validate your sources. Typing it into ChatGPT is not what you want to do to find an answer.
I thought Chat knew everything.
Chat will tell you you're right about the sky being mocha colored. So, no, it is not the thing. There's so much misinformation, but it's so important that we do approach this with respect and compassion, because people care. And that's our commonality, is we all really are just trying to do the best we can with what we've got.
And that's definitely what we want to do. We want to have a conversation. We want to acknowledge that parents have fears, rightfully so, about their kids getting things, and we want to accommodate that, but also let them know that, hey, you can talk to us, what sources you can have to kind of move the conversation along. And then at the end of the day, hopefully we come to an agreement, an agreement of how to best protect your child.
So Dr. JP, what are some final tips, some final reminders that we can have as we're preparing for back to school and beyond?
Yeah, I would say if you can, get back in with your pediatrician and then get those vaccines going. I think getting that protection happening, I think that's going to be really important for us. And then talk to people about it. People are kind of skeptical and you feel strongly about something, and let's have that conversation. I think that's really important.
So I want to get to some practical tips about this. We know school it's just right around the corner, starting up in what? I'm talking to the teacher here.
Yeah, it starts August 11th, y'all. August 11th is the first day of school.
So how can folks avoid that last minute rush?
Yeah, do it now.
He's like, now. Make your appointment now.
Make an appointment now, because you're right. You're absolutely right. Things get booked up. It's really hard to get in to see a pediatrician as you get closer to school. It's really hard to make an appointment with the Southern Nevada Health District. So as much as you can do that now, this is a good time to do it. All these places are air conditioned. Get out of the heat and get in there, go do it, and then, be on your way.
Yes, because they will delay y'all if you are not vaccinated before school starts. They will delay you. Your kid will not be able to go to school.
That's absolutely true.
So before we let you go, we've talked a lot about, what parents should be thinking about. How do parents have this conversation with their kids?
Yeah, I mean, I think that, that's a little bit easier, I think. Like when they start to talk about that, especially as the kids get older, they're looking at this from a science perspective too. They're looking at it from a common sense perspective. And so I think it makes sense to talk to them about it, because you do want them to be involved in their own health care and have ownership of it. And so kids love to talk about things, especially when you bring things up. So I think that's a good conversation.
Fantastic. Well, Dr. JP, thank you so much for joining A Healthier Tomorrow and for all of this information. We're really celebrating community health here, right?
Yes.
Vaccination shouldn't be a chore. It's really an act of care for our communities, for our schools, our neighborhoods, and for each other. So thank you for the work that you're doing. And I want to bring my little to you as a pediatrician and take good
Would love to see it, yeah.
And Jazzmin, thank you for hanging out with us. Before we let both of y'all go, we want to know, what are you doing to take care of your own health? What are you doing to take care of yourself?
Well, I do enjoy working out. I don't do it as frequently, but walks is something that I enjoy. Not in this heat right now, but it is something.
When the sun goes down.
When the sun goes down after 7.
Yeah, I'm with her. I do the same thing. We go out for walks in the evening when it's kind of cooler out. Yeah.
Good.
All right, y'all. So in line of Dr. JP, we want to let you know about a few community events that are happening. The Clark County Family Center is actually doing free vaccinations and immunizations in general, July 9th and the 16th from 8:30 a.m. to 3 p.m. at the Clark County School District Family Support Center. Sign-ups begin at 8 a.m. It's first come, first served to the first 120 people every day. Please remember, vaccinations are not offered on a daily basis, but if they are there, July 9th and July 16th from 8:30 to 3 p.m. You also are getting ready for school. Student athletes, this one is also for you. The Clark County School District Family Support Center, July 31st, are doing student athlete physicals, and this will be July 31st from 8 a.m. to 3 p.m. You can reserve your spot at bit.ly/free sports physicals CCSD. We got time for a couple more? Oh, okay. Southern Nevada Health District, as they shared, Dr. JP shared, you are also able to get your immunizations there. So you can go to snhd.info/BTS to book your appointment and beat that crowd. Did you know that July, we're really focusing on self-care?
That's right, we are.
We're going to sit there and make sure we're going in, make sure you're thinking about your well-being and thinking about how you can improve your mood, your stress, and your overall health. And you could do things like that by possibly going to the center and diving in and learning some crafts. They're doing it every other Thursday starting at 6 p.m. Check out the website in conjunction with the the Library Center. And then last but not least, July 28th from 9 a.m. to 12 p.m. there is going to be a hepatitis awareness breakfast. And it's an opportunity for us to raise awareness, share knowledge, and connect for care. Attendees will benefit from presentations, panel discussions, resources that empower you to take charge of your health. There's also be free hepatitis C and HIV testing available on site.
This has been the A Healthier Tomorrow program. I am Will Rucker.
I'm Sierra Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So take care of your health and live compassionately. Join us next time.
Bye, y'all.